Pleasure to have you all here with us today. My name is Lillian Galley, and I'm a UC Davis alumnus, as well as the Chief of Staff this year for pre-health programming. It's an honor to introduce our next keynote speaker, Dr. Alexander Rosna. Dr. Rosenau is nationally recognized as a leader in emergency medicine, with many significant achievements in emergency department operations and emergency medicine education. He is currently the president of the American College of Emergency Physicians and senior vice chair for the Department of Emergency Medicine at Lehigh Valley Health Network, where he became the first emergency medicine residency trained physician at the start of his career. Dr. Rosenau has also served as medical director of several EMS operations and recently served as consultant to the CDC's pandemic flu triage project. He is an associate professor at the University of South Florida's Morsini School of Medicine, and in addition to his leadership and management activities, Dr. Rosenau is known as a mentor to many young physicians. He is a community leader with service to various organizations. Please join me in welcoming Dr. Alexander Rosna.
Thank you. We have a small but very intrepid group. I really appreciated Dr. Warshaw's comments. I spent 3 years in the U.S. Public Health Service, only 180 miles from Philadelphia, Pennsylvania, and yet I was the only doctor that lived in the county. And there were no emergency services before I arrived. There was not a defibrillator in the county before I arrived, and that was 1982, not 1882. So it's really fascinating about how things continue to change. I'm an emergency physician, the regional EMS director, and I'm also the fourth-year med school course director for the University of South Florida's SELECT program, which is a very special program where 50 students from that medical school spend their last 2 years at Lehigh Valley Health Network. So I have a story to tell you today, a personal story, a professional story, and advice for you. For those who are here at the end, I have a series of bullet points for your, advising for your application to medical school. I originally was told that this would be a large group of high school students, so I revamped my remarks this morning because I understand most of you are pre-med already in college, correct? So there we are. So crossed out a bunch and added a bunch, and I am thrilled to be with all of you today, and I want you to know that I love being an emergency physician. How many of you have been to an emergency room? Anybody? Oh, look at that. It's a pretty scary place, isn't it? So what exactly brings people to the emergency department? Well, we treat people with time-sensitive problems that will get worse if we don't address them. Every day we see motor vehicle accidents, strokes, heart attacks, gunshot wounds, severe infections. Sometimes we have surprises like the Ebola, but many other things too. One of the only SARS case ever to come to the Lehigh Valley, that's eastern Pennsylvania, showed up one night because we have Lehigh Valley International Airport 5 miles from one of our hospitals. It's an international airport because it receives 2 flights from Toronto each week, and yet we managed to import a SARS case. So patients and families are very scared when they come to the emergency department. They're worried if things will turn out okay, and often people are in pain. But one thing is for sure, we're there for people every minute of every day, and our goal is to comfort and care for, and sometimes even to cure the problem for which they came in. So emergency care is the unscheduled, undifferentiated problem, the care of people with unscheduled, undifferentiated problems. And this is where I work, by the way. This is Lehigh Valley Health Network. We have a couple more buildings since this slide was made, and the circle is around the part where the helicopters land and where I work in the emergency department. The ED staff works as a team, and the pace is very fast, and we have to gain the trust of our patients within just a few minutes. I've learned how to make a relationship with people in 3 or 4 minutes, gain their trust, find out what's wrong, and let them know I'm there for them. A team is not about people who work next to each other. A team is about people who are accountable to each other, that are prepared to do a certain part of the job and to do it, and to be, like I said, accountable to each other. My team is my resident, my physician assistant, nurses, the unit secretary, the respiratory tech, and myself. There's chaos, but it's predictable chaos. Sometimes we fix things very quickly, If you come in with a heart arrhythmia and I need to give you some adenosine intravenously or to shock you, I can very quickly change the outcome of what's happening to you that day. But a lot of the problems are much more subtle than that, and we have to slow down, sit down, and really listen to the patient. So I want to tell you 3 very quick, short stories that I think will illustrate just a little slice of what I've done over the years. So a few years ago, it's Christmas Day. I always work on Christmas. And a young father carried his limp, unconscious 12-year-old right through the ambulance doors. And the father was scared. He looked terrible because his son was unconscious and looked like he was near death. It was very jarring to us because we had had a quiet morning, and all of a sudden, there was a call to action. So the first thing we did, of course, based on our training, is a simple fingerstick blood sugar. And right then and there, we diagnosed diabetes. This child had developed diabetes in the previous month, unbeknownst to anybody, and his sugar was 10 times normal. It was 1,000. And if your blood sugar becomes 1,000, you become very dehydrated and electrolyte imbalances, and you can, in fact, die. So we gave fluids, we gave insulin, we gave the proper treatment, and he soon was aroused, and of course he had to spend a few days in the hospital. But wait, that's not the end of my story, because a year later, it's around Christmas again, and lo and behold, the father brings in his 8-year-old son with a cut, a laceration in the arm. And I prepare everything and keep the child calm and explain what I'm going to do and numb up the wound and start suturing. And all of a sudden, in recognition, the father looks up at me and says, "Do you remember me? I'm the father of the son whose life you saved last Christmas." So the only thing I can say about that is, yes, it was a good day to know that 2 Christmases ago I had saved one son's life, and when I say I mean the team. And then the next Christmas, something minor with this other son. So we do treat families and communities. We get involved in transition and coordination of care. And there has been a lot written recently that emergency medicine has become the hub of the enterprise. We make decisions like, are you in or are you out? Are you admitted or you're not admitted? Can we put you in an observation unit? Should we be involving the hospice and the palliative care folks? Will you be going to an extended care facility? Should you go upstairs? There's humor in the ED too. I'm about 58 years old now, so about 23 years ago, I had a patient come in. He was 90 years old. He had fallen. He had trouble walking. I had to examine his hip and his muscle function. And while I'm talking to him, he says, "Doc, how old are you?" And I said, "Well, I'm about 35. And he goes, "35? I've got underwear older than you." So there is that little bit of humor too. And that's why I grew a beard. That day I decided to grow a beard and look a little older. And now I am older, so I think maybe I'd like to shave some years off, and maybe the beard should come off now too. Another story. I'm in the public health center clinic. I mentioned to you that I worked in the public health service for 3 years doing family practice. And 2 brothers came in. One of them was bleeding from many little wounds. And let me see if I get another slide up here too, because I hope you're reading some of these slides as I'm talking. And so the brother, the story goes, and I'm observing as he comes in and tells me the story, he's wearing a cap with turkey feathers in it. And the story is he and his brother went turkey hunting, and they had camouflage on. And they got separated while they were hunting. And suddenly the older fellow sees feathers, says, "There's a turkey," takes aim with his shotgun, and just at the moment, the younger brother jumps up and says, "Yo, bro, don't shoot." And of course, by then it was too late, and he shot. And luckily, none of the pellets, which did hit his hands and his face, still have pictures of the x-rays, it all turned out okay. I took a few of the pellets out. A few of them he'll live with forever. And that's not the end of the story either. Now, 10 years later, I'm now working at the hospital that I'm in now, and a fellow comes in his 30s. He had been playing with some firecrackers, and now he had the wrapping from the firecrackers in his eyes. He had burns on his face. He had wounds on his hands. And I looked at him, and I recognized him. And I said, "Why did your brother shoot you 10 years ago?" And he looked very spooked, like, how did I know this? He didn't know that 10 years ago in the public health service in very rural Pennsylvania, I treated him for his gunshot wound, for his shotgun wound, and now here he was with the firecracker problem. So I guess he was still doing dangerous things without the care that was required. a picture that I think this was from Life magazine of John Wigenstein, and he was the founder of our specialty, which is actually a very young specialty. So in addition to practicing emergency medicine, this year I've had the privilege of serving my entire profession of 33,000 members of the American College of Emergency Physicians. We do a lot of planning. We work with the government in advocacy. We create treatment guidelines and quality measures. And right now we're really paying attention to Ebola. And this is a slide from many years ago where we were already training for bioterrorism at Lehigh Valley Health Network. So the Ebola scare is out there, the enterovirus D68 scare is out there, because I want you to know that in addition to all the clinical work we're doing, we do a lot of training and education and research. And this is a picture of one of my colleagues, Marna Greenberg, and she just put on a national conference on gender disparities in the provision of emergency care. And she's an expert in that area. So emergency physicians, I want you to know, do a lot of the work that you just heard about from the gentleman from the American College of Surgeons, because we treat everybody 24 hours a day, whether they can pay or not. One of our past presidents put it this way: no shirt, no shoes, no problem. And we take care of anyone, anything, and anytime. So I want to start to concentrate just a little bit more on some of the reasons that you came to this conference today. A leader once was heard to say, where you're going is where you are. At first that sounds confusing. What does that mean, where you're going is where you are? I think it means if you know your destination, it's already there in your thoughts. You're already dreaming, and you've made a large portion of the journey, at least in your mind. When you've practiced that, you pre-visualized, you're ready to make the final step. Anybody that wants to get anywhere has to first identify a goal, and then they have to go for it. And the go for it part takes a lot of time and a lot of effort. But you know, time keeps moving whether you're involved or not. So it's not good to get off of that bandwagon. You have to keep moving with time. I have to believe that's what my parents thought when they immigrated to this country from a war-ravaged Europe. I was going to tell you a little bit more about them, but I'll just mention that my dad only finished 8th grade because he was enslaved by the German Nazis at that time. And we're only talking about 70 years ago. My parents survived. They knew they had to come to the United States, and it was hard for them to get here. They did not have any family here. They came through Ellis Island in New York, which was a central receiving area for immigrants at that time. And they had no money, and they had no family to help them out. And my dad's first job was sweeping the floor at the A&P Supermarket Bakery on night shift. And my mom went for further studies and took the nursing training she had in Germany before the war and was able to make that into something and be a nurse in this country. And I actually remember my mother going back when there was a change in leadership at the hospital she worked at, and they didn't want general nurses, they wanted registered nurses. I remember her going back to school, to community college, and becoming an RN at age 50. And watching her study like that was a big inspiration to me. So I have 3 sisters, and I'm the first in my family to be born in this country. You wouldn't know that looking at me, but like many of you in the room, I've faced some adversity. And I've been working since I was 12, and I hope all of you know, and I'm sure all of you have been working very hard. And some of my jobs are very simple. Newspaper boy, sold shoes, worked at the 7-Eleven, which is like a Wawa, short order cook, collected tolls on the Pennsylvania Turnpike, waiter and dishwasher during college. And I love science, especially biology, and I knew I wanted to work in healthcare. Doctors currently go to 4 years of medical school. You know that in California there's been some talk about 3 years of medical school, and there are some special 6-year programs out there. There's 2 degrees that allow you to practice medicine in this country: the DO degree, the Doctor of Osteopathic Medicine, and the MD degree, the medical doctor degree. And there was a big difference between them 100 years ago. The DOs were learning about mechanical manipulative medicine, and it actually started with Andrew Taylor Still in the Civil War, back when the MDs were doing things like giving you arsenic for your infection and leeches to bleed you and so on. And so their alternative forms of medicine came around. Antibiotics had not been invented. And in 1918, when the Spanish flu epidemic, actually pandemic, hit the world, those treated by DOs had the advantage of manipulative medicine, which we would call these days respiratory therapy. And things have changed, of course, and there's been advances in medicine, and now the DOs and MDs essentially practice side by side, same type of medicine in the same institutions. So I would say there's almost no difference in practice, except in some of the DOs who continue to do manipulative medicine. In California, there are 9 MD schools and 2 DO medical schools. Nationwide, there's about 19,000 medical school slots for 38,000 with 38,000 applicants. I just got that data this morning. Thank you. And there's also 800,000 doctors, 3 million nurses, 110,000 PAs, physician assistants, and over 100,000 nurse practitioners in the country. Many business administrators and technical jobs that are also of interest to some of you if, as you heard from the panel earlier today, you decide to take a route other than medicine. All these jobs provide a lot of job satisfaction and have decent pay. I really like taking care of my patients in the emergency department. I make relationships with them, and they're quick, and the patient leaves. But for many of the patients in my area, I will see them again, unfortunately, especially those with chronic problems that tend to have what we call acute exacerbations. And it's not easy to work in the ED these days. We're very under-supported by society. We know that the population is aging. I'm going to give you a figure. Does anybody know what the figure 10,000 means? Anybody in the audience? That figure was advertised or spoken about quite a bit a couple of months ago. 10,000 is the number of people in this country who turn 65 every day. So the main part of the city I live in, even though the metropolitan area is 800,000, the city of Allentown has 125,000 people. That means the city the size of Allentown turns 65 in this country every day, and that will continue to happen for the next 20 years until we hit 75 million people. Those are the people that are in the baby boom generation that was born from after World War II, 1946, through 1964. And I'm right in the middle of that. I was born in 56. So the number of people coming to the emergency department has increased by 33% in the last 12 years, and the number of emergency rooms has increased by 2%. So I end up treating people in the hallway, which I don't like to do. And I certainly don't ever want to find out that I've treated an Ebola patient who's been in the hallway and contaminated others. So how do we get this job done? And we get it done with teams. It's all about the patient and being that team. Currently, there's a growing shortage of doctors. We think that there's some argument on this, but we think there's probably a shortage of about 110,000 physicians, and more than half of that is a shortage in family physicians, and especially getting family physicians into what sometimes is called the flyover state. So I apologize to anybody who's from a flyover state. That's the states of Montana and Utah and Wyoming and Nebraska, and some of the states that really have small populations, and the airplanes tend to fly over rather than land in them. But the populations are growing, and we want access to be equal access to care for everyone in this country, and that's part of the reason for the Affordable Care Act. But I'm here to tell you that coverage does not equal access. We need more physicians, more physician assistants, and more nurse practitioners. Now, I know a lot of you have heard that, and this is an important slide, by the way, and this will resonate with the last minute of what I'll talk about with emotional intelligence. People really want their medical student applicants to be smart, and they want them to be accomplished. But more than anything, they want to bring people into their programs with emotional intelligence, people who understand who they are, can handle their emotions, understand who others are, and then in social situations, with awareness, can handle the emotions of others, how we treat ourselves and each other. Like, we know what our intentions and our motivations are, but people around us are not like our grandmother. They judge us by our behaviors, and that's an important thing to know when you go to medical school. And for those of you who are wondering, boy, it's a lot of years to get there, but you do get there. And when I was in California many years ago with my kids and we toured around, I took a picture of this very small redwood pine cone. It was less than an inch long. But that pine cone is how that tree that was 363 feet tall started. So I want you to know it's doable to become a physician and to do well, no matter how you do it. I have full respect to people who take the gap year and learn, and equal respect for people who go right through. In my case, there were a lot of strikes in the Philadelphia school system during the year before and the year after that I was going as a senior, so I actually skipped the last year of high school and then went straight through. My experience, my gap year, was not a gap year. It was the 3 years between finishing my internship and then going and deciding to do emergency medicine as a profession. Because for 3 years I practiced as a family practitioner. I had a lot of independence in a county that had no other physicians that lived there. And during that time I figured out, do I really want to be a surgeon? Do I want to go into internal medicine or family practice? And I fell in love with emergency medicine because those were the people that needed me the most at that time. Looking back with the experience and the knowledge that I have now, yes, I was an important part of their life. Probably what they needed more than anything was the job I actually did, which was to be a good family practitioner. So it's very doable, and eventually your finances catch up, and you're able to pay off your debt and live a decent life. But you do have to be willing to work very hard. There's no doubt about it. You have to be willing to deal with failure once in a while, put up with not getting rewards immediately. The nurses you work with have been to the Caribbean twice. They have a little house, and they're on their third car, and you're still working on some 12-year-old car that you're driving. You've never been on vacation, and at least if you come from a family like I did, and any money that was in your pocket, you earned yourself. Emergency medicine, to the women in the audience, I want you to know, is very, very friendly to women. Because if you decide to have a baby or you want to work part-time, emergency medicine still consists of shift work, day, middle, and night. You can choose what shift. People are thrilled to hire you to be a half-time physician. There are lots of job openings. It is not filled yet. It may be filled in 10 or 15 years, but not yet. And I'm proud to be an emergency physician because we never shut the light and we never lock the door. We're a very, very important part of the medical neighborhood. One of my partners, Joe Sexton, gave a lecture to emergency medicine residents, those who were about to finish their training and actually get their final job at a hospital. And he came up, I love this slide, and that's why I took a picture of it. There are about 300 residents at this lecture. And he said, before you search for a job, make sure you do a mind search. And I thought that was such great advice. Because before you go to medical school, you heard so many opportunities from the panel this morning. You heard about the gap year. You heard about some very altruistic opportunities. And you also have the reality of the families that you live in. Some of you may find out that you have kids during medical school. You may be married. You may be taking care of a sick relative. You may be very important to supplying some income to your family. So you have to do a mind search as to where you want to go and where the people that are important to you see your place in the family. So we're a very important part of the safety net for the whole country too. And I want to transition just to the last few minutes of my talk, which is how do you get there? And I think everybody in this room knows that 90% of success is showing up to play. You have to think very seriously about your career path. You're going to face obstacles, but they can be overcome with perseverance, planning, good advice, and hard work. Not just dreaming, but actually planning. You have to set your goals. You have to search for mentors to help you along the way. A mentor could be your family doctor, school counselors, a teacher, your priest, somebody that you know in the community who has already walked through that journey. And surround yourself with like-minded friends who support your efforts to work hard, study, and help people. You don't want to be with a bunch of people who just love to party every Friday and Saturday night. You don't want to get in with the wrong crowd. You have to get in with a crowd that really wants to do and accomplish what you want to do. It doesn't mean you can't have lots of fun. Explore your options like scholarships, loans. And a lot of these loans and scholarships, you don't have to pay back until after you finish your residency. The schools will help to hook you up with some of this. And there are other options. For me, my father lost his job in the recession in the 70s. Certainly my parents were they were blue collar, did not have a way to pay for me to go to medical school. So after my first year of medical school, I joined the U.S. Public Health Service, and they paid the tuition for 3 years of medical school. And they also gave me a few $100s a month to live on. Not a whole lot of money, but it certainly helped. And then I paid them back with 3 years in a rural area, and the 3 years that I spent in the public health service as a physician gave me more than anything I ever gave to them. I also have many friends who joined the military, where they agreed to, the military would pay for medical school, and then in return, they would have to give the time back. So to get a jump start on your decision, consider becoming a volunteer, maybe with your ambulance company, with your local hospital, but do something that helps you to understand if you want to do this. My son is a postdoc neuroscientist, is pretty well published these days, and he's at Vanderbilt University. And I encouraged him, and he did a whole month in learning how to become an EMT, and he ran with the ambulances for 2 months. And it was a very valuable experience. It taught him one thing. He came home one day and he said, Dad, I don't want to be a doctor. So for him, it was very good. It helped to crystallize for him that he loved science and basic science, but not medicine. And that's another reason that you do things. It's not just for what goes on your CV, but it's part of your mind search. Now, there's another tip that I would like to give you that I didn't quite hear from the panel up here that you really need to know. When you interview, the most common type of questioning you'll run into now is called behavioral interviewing. Make sure you Google that and you're prepared for some of these questions. Behavioral interviewing is a style that asks you to describe actual events in your life. Not something where somebody would ask you a pat question. It would be very simple at your level of intelligence to figure out where they're headed and just give a result. But rather, actual events in your life, how you address conflicts, what you learned from it, so that rather than predicting how you would act in a situation, it seeks revelation about who you really are and what you learned from it. And even if you describe a poor reaction, what did you learn from that poor reaction? How will you change your behavior in the future? So behavioral interviewing is going to be something that is definitely done when you apply to medical school. And in fact, in our SELECT program, we specifically interview for emotional intelligence. So that's something you can Google, Daniel Goleman, Goleman. So it's a tip that I think is valuable to you. And I want to thank you for allowing me to share my story with you today. I think you've taken a great first step by coming to UC Davis today and being with like-minded people and to get some tips along the way from people who've been through it. It's a big distance from where you are now to that first day on the job where you put on your white coat and somebody depends only on your decision and you don't turn around to your mentor and say, what do you think? This is what I want to do for my patient. But no, you're the one where people are turning to you. It's a step, though, that it's like anything else. You take the first step and the second step and so on. So I look forward to speaking with all of you during lunchtime. I wish you the best of luck, a healthy life, and I know that you can get there if you go for it. Thank you.